Today is Jonah's surgery. It starts at 5:30 in the morning, going to the pre-surgery room, just where they get him ready and prepped. And then about 7:30, taking him off to surgery.
Yeah, it's a little overwhelming considering how long we've been waiting for it. So it's kind of surreal that it's here now, but we're ready.
There's no commonly accepted criteria for when Tourette's would be considered severe, but it would be considered that when it severely interrupts their quality of life, so that it disrupts their education, their sleeping, their interactions with people. You would never consider DBS for a patient who did not have Tourette's severe enough that it really interfered with their quality of life.
Think about all the cool stuff you're going to be able to do now.
What do you mean?
Like stay home by yourself, go out for basketball.
I'll be able to babysit.
Aren't you excited a little?
Yeah, I'm a little scared.
When we think about the risks of DBS, they are different for a child and for an adult. You worry about the risk of the brain, and that might be 1%. You worry about the risk of infection, which is probably 4 or 5%. But honestly, the main concern that you have is that the child will go through this, have this complicated procedure, and then not have the result that you hope to get.
It is thought that the feedback circuits within the basal ganglia may have an abnormal information pattern. We're going to interrupt the abnormal signal that's interfering and causing the tics in Jonah. This is the exact point that we want to go down with the probe.
We make the holes in the skull, pass the microelectrodes down very gradually and slowly, listening to the neurons as we go down. The degree of improvement varies. Some people, the number of their tics decreases by 90 or 95%, sometimes by 60%. That's the usual range. But there are a few patients who have almost no response to it.
They'll ask you questions, okay?
If I have a problem with answering the question,
I'll fall right in, I'll jump right in there. But I think that you can handle it, okay? Just be yourself and tell them what it is that you're interested in and what you can offer, okay? All right.
Where did you go to school before Summit?
I didn't really like it that much because the kids didn't really want to accept me for who I was and the way I had tics.
We have a school that accepts people for who they are. And we work around whatever issues you have and give you the chance to learn and do the best you can.
If he doesn't make it into Summit, we are back to square one. He has to do home instruction. And we have to figure out a plan. We hope to maybe that the school system will educate educators about Tourette syndrome so that he'll be able to go back into a general setting.
This board here, this is an extension.
I'm a little nervous, but I'm a little confident as well. And I feel that I will find the right setting if we just look hard. If I don't get in, I'll just have to find another school with a proper setting for me.
I'm here to talk to a group about Tourette syndrome and bullying. I want them to learn that bullying is wrong. I also get nervous in front of the crowd a little bit, so it takes a while for me to get used to talking on stage. I have something called Tourette syndrome, and it makes me like jump, make my eyes twitch, move my head. How does it feel like to be bullied? It feels bad when people pick on you because you're different.
My name is Dash Myhawk, and I'm an actor and a musician, and I have a complex form of Tourette syndrome, much like Jalen does, and he reminds me a lot of myself when I was a kid. Mine has subsided some over the years because it tends to subside in adults. We're really here today to educate kids and adults the same about Tourette syndrome and about bullying and how it affects people's lives and how to stop it in schools.
Do y'all want to change the world? Yeah?
I think it will well in there today because they looked like they were interested and they were listening to me and they seemed like they had a lot of fun, and I think that they learned not to bully anymore.
Even after the surgery, I still have tics, but they're not even close to as severe as they were, and not as bad and as frequent.
We felt the surgery was the last option that we had to give Jonah a normal life. He hasn't really run too much recently. It's more body and facial tics that last maybe 5 to 10 seconds, and then he shakes out of it, and that's it.
Jonah's doing a lot better. He's ticking a lot less.
We've been to the doctor about 4 times now in the last month, and the doctor goes in and changes the voltage on the electrodes, and then he also changes the shape of the arc that's running through. He's twitchy still a little bit, but they're nothing compared to what they were. He's fully functioning and can do pretty much anything any other kid can do.
It has changed my life a lot. Now I can do basketball and I can babysit people. I actually just went to a babysitting class, and now I'm certified to legally babysit my brother. I'm gonna have a lot of fun with it.
A lot of people think that nothing good ever comes to having Tourette's, but I've found a couple things that have come from Tourette's, like humility, self-confidence, focus, exercise. I get a great exercise every day.
I want it to become well known to all people, so life can be easy for other people who have Tourette syndrome, especially kids. I like the way they make you feel at home and make you feel that you can be accepted for whoever you are. Yeah, this is gonna be a place that I enjoy going to.
If people started becoming accustomed to seeing Tourette syndrome on a more realistic level, other than a humorous level, I think that would be the first step.
By the end of the night, it was screaming, oh! I was working on I heard you bounce. Bullying?
No way! Bullying? No way! I have advice for the Tourette people. Be happy for who you are, because you may, at first, Tourette syndrome won't show you the good side, but once the bad things are over, it's gonna end up backfiring on the bad things. It's gonna end up being good. Trust me.